I want to thank the panelists for desperately trying to avoid the big zero sign that I had under my desk. So I just have a follow-up question before we hear from the committee. A couple of you mentioned the kinds of needs you would see to improve professional development, but not everyone. So I think, TJ, you mentioned a few. So I'd like the rest of the panelists who haven't given us that to just give us maybe two of the top needs that you see that would be helpful in improving professional development to support a workforce that's dealing with children from birth to 8. And we can start, Christy, can we start and go down?
Sure. So I think one top need that I did mention was the need to make sure we include administrators in this work. Mm-hmm. And then a second, and I think these were both inherent in my presentation, a second is to not just focus on the content and skills that the workforce needs, but some of those personal attributes in health and well-being that's going to actually make them more effective and sustainable leaders in the work. Thank you.
I would really echo that. I think a lot about how important it is to focus on leaders and particularly their skills related to supporting their organization's capacity to be a host for an effective early childhood program. What are the skills that they need for that, and making sure that workforce development and professional development experiences target that content and those people. We spend so much time focusing on what the individual workers are doing, and we can't do just one. We have to do both. So I think that's really my biggest thought.
I'm so glad you asked, Jeff. I really think that a couple of the biggest needs are related again to looking at the workforce's conditions and the application, as you're saying, to be able to sustain, that really to raise quality and retain effective teachers, the states and territory systems need to look at compensation, workforce conditions, and compensation, workforce conditions, and access to professional development at the individual level, at the program, the employer level, and at the system level. And stabilizing programs, I do echo what Christy and Claire have just said about looking at how to improve administrators' leadership skills and methods of proactively managing turnover. Because really, we know that workforce turnover is detrimental to promoting that stable, consistent relationships that we've been saying are so important, but if you don't have the stability in it, and when we talk about continuity of care, it's so much more than what we used to mean by it. The other piece, I'll just say really quickly, is that I think the scaffolding, the same scaffolding we look at and encourage for building young children's knowledge is also necessary for our workforce, and thinking about that entry to advanced use of scaffolding where teachers who are coming in as more novice teachers need that fuller toolkit with them, that intentional sort of model of teacher as a technician with a full curriculum and toolkit with them, and looking towards more experienced expertise teachers who can intentionally integrate curriculum and concepts on the other end of the spectrum.
Okay. Okay, two quick things. One is actually piggybacking on something TJ said. I think there's an issue of funding when we're talking about some of these more in-depth, kind of longer-term follow-up types of in-service experiences. I was encouraged to hear how your district has figured out a way to almost flip the model on its head to free up the extra time for folks to do that. Focus on small groups or individual work rather than the large, in-service ones that they're used to. So trying to figure out, it is a systems issue within school districts, and trying to think about how to use funding a little bit more in a targeted way to these types of PD that we know are actually connected to skill development and practice. The second piece, I didn't get to talk about that much in my talk, but I think it's to unpack a bit some more specific skills that we might be wanting to see early care providers and teachers develop. So, I got on my soapbox about interactions, but they're extremely complicated, right? There's a lot that goes into making those happen. And so, one of the things we've been looking into is that, for a certain set of teachers, it may help if they have the ability to actually see effective interactions in practice in order for them to actually do them, right? So if they can't even see some of those intricate back and forths that others are showing, it'd be very difficult for them to replicate it themselves. And so that's a skill that could be taught and practiced that could lead to effective interaction. So I think more unpacking of that would be helpful.
So I'll just say one thing. It's almost May. It is May, whatever the date is. May is coming. Graduation is coming. All across this country from distinguished universities, we will graduate early childhood education students with very little, if any, preparation to use digital media appropriately and intentionally in their classrooms. We are behind this already. We've really got to think about this as a critical need. That's the pre-service question. The in-service question is we've got teachers with young children right now looking for help and wanting to know how to do this well. So we have a systemic issue. Those of us who've been teacher educators a long time and whose hair is this color now as a result, we're wrestling with needing to get competent about all of this and catch up. But we really can't wait for the junior faculty to do it. We've got to embrace it too.
Thank you, guys. One more. Even though Christy, I know this is the question you don't like and you don't want, but I'm going to ask it anyway. Clearly, for professional development to be effective, we have to change teacher practice. We also are thinking about the ways in which that change in teacher practice affects child outcomes. So anybody on the panel, can you share with us some of the ways in which you've been thinking about how your professional development has, yes, changed teacher practice, but right now specifically I'm asking, how has it had an impact on child outcomes? Don't all jump in there at once.
I'll speak to that from just a really general systems level, Jacqueline. So our services, the technical assistance that the Administration for Children and Family supports and other TA providers out there to state systems are really helping states and territories in their hard work of developing systems that are based on core knowledge and competencies that focus on intentional teaching and aligned research-based evidence, the best to what we know, which I'm hoping this panel will contribute to even more. But again, back to the idea that scaffolds children's learning across all developmental domains. So on a systems level, having that intentionality in the teaching based on our core professional standards as a foundation and scaffolding the learning for the children are the outcomes that we're after from the systems level.
Okay, great.
And I don't like it, but I won't avoid it. But I am going to demur just a little bit still, is that I think, at least with our program, we also have to recognize that this kind of professional education takes time to roll through the system. Mm-hmm. So the fact that you've educated people this year doesn't necessarily mean you're going to see child outcomes next year. And so I think we have to be really explicit about how realistic and in what kind of time frame we can expect to see changes in child outcomes. That said, we do talk about child outcomes in 3 categories. We really want to see cognitive change, not just in literacy, but also in math. We want to see improvements in social and emotional competence, and we'd like to see deeper engagement in learning from the children themselves and from families. And so I can say that some of the districts that I have been involved with are beginning to see shifts in at least those first 2 categories, cognitive and social and emotional, based on GOLD data. Mm-hmm. And this is primarily at the pre-K to K level. As they become much more intentional about building the teacher teamwork and the vertical relationships between pre-K and K, they actually are beginning to see some shifts in those child outcomes.
Thank you.
If I could add, while we're talking about instructional practice, we can influence a teacher's instructional practice and see some change in student outcomes in small levels. But really what this professional development needs to get at are teacher beliefs and teacher behaviors, which are much more challenging. And so while ultimately we're trying to impact student outcomes, the outcomes that we're identifying along the way, because this is going to take a long time. It needs to be incremental. And while we ask teachers to be working in professional learning communities and setting small goals, we need to be thinking about that for our professional development. And it's in smaller learning communities where teachers are part of the goal setting, identifying the student outcomes that they are targeting, identifying the instructional practices and behaviors that, that are going to help impact those student outcomes is how we actually get those small wins that in turn influence teacher beliefs.
Thanks. Jason?
Sure, I have two quick things to add. One is that in some of the MTP coaching work, a couple of the different projects, you didn't see the impacts on children or students in the classroom until the second year with the teacher's next cohort of students. So it does align a little bit with the idea that Christy was talking about, although that's not always true. We've also had some small effects in the first year of implementation. The second point is just to underscore something I said at the end of my talk, which is that I do think we've seen more consistent impacts on children when the focus of PD on interactions is paired with an evidence-based curriculum or really strong subject content. And so we haven't systematically varied those things to look at them together, but I would say anecdotally across the projects, you tend to see more consistent. So I think there's some of this is like, what are the ingredients together that will change the teacher behavior, but also will ultimately have the largest magnitude impact at the child level.
Great. Okay. Thank you. So let's see if we have questions from the committee. And any? I don't see any hands from the committee. Oh, we have one.
While they're gathering their thoughts, can I actually chime in one more bit on the child outcomes bit? Is the notion, because it hasn't really come up today, is the notion of dosage. That sort of 1 year of good teaching is good, 2 years is even better, and it's why this sort of vertical teamwork year after year after year is important. And so I think we also need to be really focused on ensuring that the PD is not just at one grade level, but really across the full continuum so that we're building incremental child outcome improvement upon incremental child outcome improvement.
Thank you.
So the dosage effect.
Thank you. Albert?
Thanks. Albert Watt from the National Governance Association. So a lot of you on the panel work with schools and school districts and school systems. I'm curious to know your thoughts about, as we think about, sort of the professional expectations, standards, guidelines for professionals who work with kids from 0 to 8. Can you comment on how wide is the gulf, if there is a gulf, between how public education teachers think about what they need to know and they be able to do versus early care and education providers and what they need to be able to do, or directors and principals?
Do you want me to talk? So I think the gulf is less than we think it is, sort of conceptually and at a content level. Not surprisingly, it's our policies and tools and systems that are the problem. And I'll give you an example. In our cohort, our P3 Executive Leadership Institute, as we were talking about teacher-child interactions, the notion came up that we are really using class rather widely in birth to 5, but in our K-12 system, our teacher evaluation model has 3 different tools that can be used, Danielson, Marzano, or 5D. And the question was asked of our superintendent of public instruction, our state commissioner, when he came to visit our cohort, what's the chances that class could be approved for use in K-3? And he said, nada, 0. Now, in and of itself, that's a policy barrier. So we then, though, scaffolded our cohort through analyzing what does class say are good teacher-child interactions, what does Danielson, Marzano, and 5D say, and you actually find out they're pretty similar. It's just building that understanding that the tools and instruments that might be mandated by the different systems, why they might be different, the deeper sort of underpinnings are one and the same, but you can't just hand them the documents. We really had to walk them through their own analysis of understanding how each of those instruments looks at teacher-child interactions. I wish policy would fix that, but it's not going to happen in our state soon.
Anybody else? Okay. Sarah?
So I'm going to say the same major issue, again, related to this. I think the biggest gulf is related to expectations, requirements, and compensation. So I do think, when you look at the alignment pieces, those are key, and the policy barriers are oftentimes perceived, and helping states figure those out and translate them for program leaders and systems are important. When you even look at the early learning guidelines that are in place across the states, only 31, which is a decent number, are aligning their early learning guidelines with K-12 standards. So we've got a ways to go there even on that level of translation, and then from there translating what we expect early educators to know and understand and be able to do based on what we expect for our children is another layer there of the gulf. But unless we are putting our compensation money where our mouth is to go along with shared expectations, we are never going to see traction on these issues that really change what our young children and families who are in the most needy environments need.
Any other committee members? Rob?
Scott, can you tell us, give us something in writing that gives the particular skills in technology that you think that teachers should have, or somebody thinks that teachers should have?
Sure.
Some way that we could, if we were to include something about this in our report, we could refer to something that says these are the 5 skills or whatever it is.
Absolutely, be happy to.
Thank you.
Okay. Any other committee member with a question? Then I'm going to open. Ross?
This is for Sarah. This is Ross Thompson at UC Davis. Can you talk a little bit about what is the child care and education workforce that your unit penetrates? And I guess by implication, what do we know about those who fall outside of that orbit, and what kinds of professional development opportunities exist for them?
Okay. So the population does vary by state, but overall, the policies and systems we work on are for the child care workforce in home-based settings, family child care center-based settings. In some states, it does include the family, friend, and neighbor care, but in most states, it does not. And Head Start, pre-K, and really school-age care up through age 13. So that's the population we work with. That piece that falls outside of it, oftentimes, I think you're getting at, Ross, the family, friend, and neighbor care and their professional development needs are very different. In fact, if we framed it as professional development, that right there may be a barrier in many cases to working with them, because they're not looking at it necessarily as a profession. So if it's really about the competency basis, where I think we all need to be moving, higher education has moved that way, trainings and modules, et cetera, I think most of us know, and most state systems know, that one-shot trainings that aren't focused on competency aren't going to get there. That kind of framing allows state policies and systems to really take similar materials and the best knowledge and learning and gear it towards family, friend, and neighbor care givers in a way that's a community-based, socially acceptable way for them to engage. I hope that gets at some of what you're asking, Ross. Yes, and some states are doing an exceptional job of it, where they are going out into the communities, even in mobile, in vans with a library, meeting at libraries, meeting at other community centers where it's the engagement is higher for that specific population. Some states have up to 80% of what they're funding through Child Care and Development Fund subsidies. Their kids are in family, friend, and neighbor care. So this is a huge population. It's hard to track. They're not in workforce registries that don't even have all of the regulated care. So it is a huge issue.
Thank you. Unless we have another question from the committee, I'm going to open it up to the audience. Anybody?
Okay, we have a question from the webcast. Christy, thank you for making the comment about adult behaviors and outcomes linked to child outcomes instead of the correlation of professional development and child outcomes. How do we explain this science and implementation science in plain language to policymakers and funders so that funding can support systems that hold young children and the workforce that serves them?
That is a lifetime's work. And I actually think others on the panel could probably answer that question as well, because I know a number of us mentioned implementation science. If it wasn't obvious in sort of my presentation, I think one of the best things we need to do is make the language more accessible of how we describe this. And so while I don't often dwell in sort of the technicalities of implementation science, I prefer to use the language of changing adult behaviors in order to get to, kid outcomes. And I think most parents, anyone who's been in therapy, lots of other lived experiences tell us that how we respond to situations often can shift how somebody else responds in a situation. And so I do think this theory of change, of figuring out more realistic ways to explain to our policymakers this, what's in my mind a rather logical sequence of changed services, changed programs, changed adult behaviors that eventually lead to child outcomes is a challenge for all of us to be engaged in. I don't have my own pat answer, sorry. Does anyone else? I might also say I do think one other thing that we need to be thinking about is what we want those adult behaviors to look like. Mm-hmm. If we have some better metrics, and I think Jason's work is starting to get at that in terms of thinking about teacher-child interactions. If we think about the kinds of interactions, I actually think our framework for planning, implementing, and evaluating pre-K through third grade approaches gets to a lot of that. If we have different metrics of how teachers are working together, the kinds of things that they're doing, the kinds of conversations they're having, the kinds of shared learning, both in a classroom environment and then inside each other's classrooms, is really important. The more explicit we can get about what those adult behavior changes could and should look like, I think the easier that theory of change is going to become.
I would also add that the context and conditions in which these changes take place for adults in the workforce takes more time than they're generally given to attain mastery or even to practice before the outcomes at the child level are expected. And by the time they are getting in the neighborhood of mastery, a new set of things that they're being asked to engage in emerges. And so this sort of rapid fire shifting of points of emphasis really interferes with any kind of development of mastery in the workforce, which also impacts retention in the workforce, which also impacts child outcomes. So we know the interconnections of all of these. So in many ways, the policy and structural contexts in which these things are desired to occur are set up in a way that really make it almost impossible to achieve it.
Anyone else?
Just one thing I'll add. I think this sets up very well to try to fund some work, which has been very difficult to fund to this point, on following an individual teacher through time. Mm-hmm. Certainly from the comment earlier and the other panel, this idea that higher ed institutions will be accountable in some ways to how their pre-service folks do with kids as they get out in the world. Mm-hmm. Well, we have not done a very good job of following teachers pre-service into in-service over time to be able to unpack some of the issues around, what happens when you have a couple, whether it's implementation, whether it's the changes in the classroom composition. So I think there's fertile ground there for us to learn more about when you follow individual teachers over time. What factors play a role in them having an impact on a given student and a given set of students.
Great. Sarah?
Okay. I think related to the implementation science question, I think a lot of it is around sticky factor, and that's the kind of language that I use with policymakers. You're funding this, do you want it to stick? And it's about readiness for change. We work with different levels of change agents and implementation teams in states, and the onus for change to happen is on the team responsible for creating, helping to generate the readiness for that change, not on the individual teacher who's expected to make that change. So depending on the level we're working at, forces the language. but sticky works. And related to your comment about tracking the teachers, all I can say again is another plug for systems to invest in shoring up their workforce data systems. We know a lot about it. We have systems that work. States are ready and willing to share this information. And when we look across sharing, teacher identification in ethical ways, programs identification in ethical ways, child's identification in ethical ways, there's still a lot of questions around it, but there's a lot of emerging best practices that can be shared across states to make that possible.
Great. Thank you. So we borrowed a little bit of time since we started late. If there's another question, then I'll ask it. I'll take that prerogative. Jason, you started your response to the last question by talking about teacher preparation and it's sort of this relationship between professional development and teacher preparation. It's really interesting. So I'd like some of you guys to give me your sense of what is this relationship between pre-service preparation for educators, providers, and in-service PD. What's it feel like?
Well, I'll start. I've mentioned this, I think, as part of the continuum. We need to be thinking about pre-service and in-service when we're thinking about the particular issue that I raised, but I think the issues that all the panelists have raised today. I tend to think of the whole teacher, so I don't get too bogged down about which of those they're in. I want the teacher to get the support they need to do their work better and to succeed with children. So while the process certainly is different and the institutions are different, at Erickson we've combined distance learning and continuing education into one department because we just see it as a mashup of new opportunities and new ways for teachers to learn and access information. So maybe we're at a phase where we just need to think about teacher preparation across the lifespan.
Interesting. Anybody else want to take a crack at it?
I think there is less and less of a gap and a distinction between the two. I think you'll see more clinical models even where practice and training happen simultaneously. And in our workforce in particular with a large population of non-traditional quote-unquote students, I think one student's pre-service is another's ongoing or in service. So we have a lot of people in the field who are preparing for their next role. So what may look like only pre-service is really their ongoing at the same time.
That's very helpful. Anybody?
And I think that only the nickel's worth that I would contribute is that we need to be thinking about these issues again, not just for teachers, but also for administrators. Mm-hmm. I mean, we have administrators in the system who might have the right credentials, degree, certifications, but have zero sort of actual lived experience with young children, just because of the natural progression of leadership, especially in K-12 systems. We often have elementary principals who were high school teachers. Doesn't make them bad leaders or bad teachers, it just means they might not know little kids. And so, or what high quality instruction for little kids should look like. So I think we need to be thinking about, I liked the word, this continuum of preparation, that sometimes we have people in the field who need pre-service experiences almost, if that makes sense. And so it's really thinking a lot more fluidly about, in my mind, those threshold points of what's before service and what's post-service and what does a degree get you, and just much more fluidly about the sort of skills, behaviors, and knowledge that this full continuum of adults in this work need.
Great.
I think this echoes many of the sentiments of the other panelists, and I don't want to give too much of a preview of the following work that's going to come after lunch, but the lines for us are very blurred. We're making a lot of intentional collaborative decisions to partner with our universities so that our pre-service teachers are in the service of our students even in their student teaching experiences, and that it's a year-long co-teaching experience that helps kind of give them some of the systems perspective as well as some of the skills that they need. But it's really more about developing this disposition of lifelong learning, of being a reflective practitioner, of being adaptive. And I think if we can develop that disposition, we're going to be having different conversations in a couple of years.
Jason?
The only thing I was going to add is in a slightly different direction, which is a number of folks have talked about identifying specific skills and competencies that may lead to the interactions with children that we're looking for in these environments. And I would say this is where assessment comes in, right? We're not particularly good at assessing those things. I mean, number one, we're not good at unpacking differentiated ways what all those pieces are that go into interactions. But even if we were, we're not good at assessing them. So you could see a world in which you would have a good assessment of something around a responsive interaction, and if somebody was able to consistently show that they're able to do that, that's what we're looking for, right? It's not the degree, it's not the certification, it's the showing of that skill in a consistent and persistent way. So I think that's a way to kind of completely blur the lines between when the PD or the learning opportunity happens. It's like, can you reach that target? And if we can assess it, then we would know.
Great. I think we have reached time, so thank you so much for the insight you've given us into the workforce. Let's thank our panel for their presentations. And Bridget, is it time for lunch? Yes. And everybody knows where to go for lunch? Follow your nose to food? Okay. Great. Thanks. We'll start up again at 1:30. Great.